With Indonesia starting its vaccination drive today, it shines a spotlight on how much Southeast Asia countries are spending on vaccines. Indonesia, the region's worst-hit nation, aims to vaccinate about two-thirds of its population by March next year. It will offer free vaccines, and that means its vaccination program will be borne by the state, and it's estimated to cost more than $5 billion. The vaccines will also be free for Singapore citizens and residents. The city-state has set aside $755 million for vaccines, and it says that should have enough for its whole population. Malaysia is spending $500 million to buy enough shots for about 80% of its population, with vaccinations set to start next month. And in the Philippines, plans are underway to inoculate more than half its population this year, with the government eyeing about $1.5 billion worth of vaccine purchases. Dr. Joanne Yong, senior economist from the University of Southern California, takes us through the numbers.
Countries are going to participate in the COVAX platform, but it's very clear that even if they do so, which would allow them to access financing for about 20% of their population at a very highly reduced price, that's still not going to be enough. And so other mechanisms that are going to be in play would be things like direct aid or reduced debt obligation from multilateral facilities. That being said, what we are seeing is also that because countries that haven't secured complete coverage under COVAX facilities, what we're going to see there is that potentially after commitments from pharmaceutical companies at the current prices expire, there may be bidding wars. So in the future, we're also going to be seeing potentially impact down the line where costs for vaccines increase and countries that have not currently secured full coverage may be exposed to that. Finally, what we're also looking at are countries where internal funding is being raised from other sources, such as donations. But occasionally, some of these donations come from large political blocs or local tycoons that may result then in politicization of this process. So I think it's going to be a very multi-layered impact across the region. But the bigger thing is that we also have to worry about the fact that not undertaking these programs has a huge cost. So we do have to balance the visible cost of the vaccination progress against the opportunity cost of not undertaking this and being left behind.